Okay, let's distinguish fibromyalgia, polymyositis, and polymyalgia rheumatica. This is a very highly talked about topic on step 2, and it's fairly easy to distinguish all three diagnoses from one another. Let's start with the one with normal labs. This is fibromyalgia. You'll see this in young to middle-aged women, and it's widespread pain that is chronic. A lot of the times these patients actually experience fatigue and they cannot concentrate very well, and they also have tenderness at trigger points. So certain parts of the body where they feel tenderness, like the trapezius or the costochondral junction. The diagnosis of fibromyalgia also needs to wait around 3 months, and their pain index kind of varies. Sometimes it's pretty bad, sometimes it's okay. And again, the laboratory studies are absolutely normal. Next, let's talk about the one with proximal muscle weakness, but not necessarily with pain. This is polymyositis. Another very high yield thing about polymyositis is multiple different elevated muscle enzymes. And I remember this because it's kind of in the name of polymyositis. Myositis reminds me of inflammation of the muscles, and poly means multiple, so I remember that multiple muscle enzymes will be elevated. The diagnosis is to check for autoantibodies like anti-Jo1 or ANA antibodies. And lastly, of course, you can do a biopsy. You'll see endomysial infiltrates and also patchy necrosis inside the histology. PMR, the last one, polymyalgia rheumatica, I think of older people, ages over 50 years old. The primary thing that they experience is stiffness. It's not weakness, it's not pain, it's stiffness. They can experience pain in the shoulders and the hip girdle. That's pretty high yield on the test, and also their neck. One huge association, and you should remember this, especially for people over 50 years old and their women, is giant cell arteritis. I digress a little, but the treatment for giant cell arteritis is high dose corticosteroids, and you want to do a temporal artery biopsy. As for diagnostic labs, elevated ESR and CRP is what you look for. And I remember CRP because it's 3 letters, and polymyalgia rheumatica is PMR, which is also 3 letters. These patients feel rapid improvement if you give them steroids.